Hi, and welcome to part 4 of Addiction 101 for family members. I'm Tom Harrison, author of The Complete Family Guide to Addiction. And by the way, everything we talk about in this series is discussed in much more detail in the book, along with many other topics as well. Today, we're going to be talking about the characteristic behaviors of addiction. In the last couple segments, we talked about what's going on in the addict's brain. Today, we're going to talk about how that produces the typical characteristic behaviors that you see in someone with an addiction. Now, if you're a family member and you're living with an addict or you're trying to care for an addict, it may all seem like just one big undifferentiated field of horror that you're dealing with. But there are, in fact, three typical types of addictive behavior. Number one would be the behavior that's caused by the substance. Now, all drugs of addiction have the same effect on the nucleus accumbens in the brain, but they all have different secondary effects. Cocaine or methamphetamine is going to make people agitated and excited, whereas other drugs are going to create a kind of dreamy euphoria. Alcohol has very varied effects. It makes some people excited and even argumentative. It makes other people just withdraw into their room. Drugs have different effects, but they also tend to wear off when the substance wears off. The second type of behavior is behavior caused by withdrawal. It's what happens when the person isn't getting their substance. Withdrawal typically makes people restless, irritated, discontented, frustrated, argumentative, irritable in general. Many people who live with an opioid addict will tell you life isn't all that bad when the person is using because they're often this happy state. It's when they stop using that life becomes miserable for everybody around. And then the third type of addictive behavior is behavior not caused by the drug or by withdrawal from the drug, but caused by the disease itself. It's the long-term changes in the brain that produce a lot of the characteristic behaviors of addiction. One that anybody who deals with an addict will be familiar with is denial. Addicts may once in a while say, "Oh, I should really stop," but the vast majority of the time, they're in denial about their own addiction and what it's doing to their life and what it's doing to the people around them. Now, denial in some people in other situations can have a somewhat positive effect. If you witness a terrible traumatic accident or you get a terrible diagnosis, your brain may say, "I don't want to deal with that immediately because it's overwhelming. I'm going to deal with it gradually." And that can be healthy. But in an addict, what's happening is they're experiencing cognitive dissonance. Part of their brain is telling them, "You must get this drug. You must use this drug. You need it. It's an absolute necessity." Another part of their brain may perceive that what they're doing is destroying their life and destroying everyone's life around them. But if they focus on that, they're not going to deal with what their brain is telling them is the more pressing need, which is getting the drug and using the drug now. So they push it away. They live in a kind of denial. And that's extremely frustrating to people around them because it's like you can't communicate, you can't explain what's going on. It's not that the person doesn't see it, it's that the person just pushes it away. Related to denial is defensiveness. Addicts are typically highly defensive. If you confront them, if you say what you're doing is harmful, if you try to talk about it, they'll push it away. They'll say, "You don't understand. I don't have a problem. I could stop if I want to. If you don't like my behavior, that's your issue, not mine," etc., etc. None of this is true, but it's what addicts say in order to push away anything that might interfere with the overwhelming necessity in their mind, which is to get and use substances. Other typical addict behaviors as the disease progresses, they become irresponsible. That's because other things in life are being crowded out by this increasingly overwhelming necessity to use substances, uh, the need to take care of their family, uh, work, other kinds of responsibilities, paying bills, being anywhere on time. These things all start to go by the wayside, and the person becomes more irresponsible in their duties. You often see addicts become immature, particularly those who start early who might become addicted, say, at 16. It's as though the addiction kind of crowds out the normal maturity process, so that even if they go into treatment and they get better and they're in their mid 20s, they may still make decisions like a 16-year-old because their brain hasn't caught up yet. The addiction has stunted their maturity and they begin to behave in ways that are immature. Another thing you see is isolation. Addicts tend to withdraw from everyone around them. And again, the reason is that people around them will typically try to bring them out, try to get them to stop, and this conflicts with their brain's increasingly urgent message that you have to use drugs and you have to keep using the substance. So they withdraw so as to prevent any kind of a conflict or anybody telling them what's really going on. If they do hang out with other people, they are often people who have a similar problem and who are not going to give them a hard time. And then as the disease progresses even further, what you see is addicts become manipulative. They become very, very good at lying, at cheating. They say they're going out to do one thing, but they use drugs. They ask for money for food, but they spend it on drugs. They steal. They steal from their friends. They steal from their family. And it's a mark of how incredibly desperate the disease has made them, because eventually all they have in their life is this unbelievable craving that needs to be satisfied by taking the drugs, and everything else goes by the wayside, and they become willing ultimately to be highly manipulative and to use their friends and their family and the people they love, which is not something they would ever do except that they have this horrible disease. So this is how addicts behave, and it typically provokes a whole series of responses and other behaviors by their family members. And in part 5, we're going to talk about the most characteristic behaviors, not of addicts, but of family members and the people around them. So I hope you'll join me for that. Thank you.